this is a very, very timely discussion today. As Caroline pointed out, we are seeing, really a dramatic change in demographics in this country. The traditional population pyramid that was a pyramid that was with many, many younger people clustered at the bottom and a relatively small number of older people at the top is changing very, very quickly into a much flatter shape. But we have really, essentially equal numbers of folks throughout all age cohorts. That's a big, big change. And who those older people are is changing as well. For example, today, 1 in 5 people 65 and older in this country is a person of color. Soon that will be 1 in 3. And by 2030, 3 to 4 million older people in this country will identify as LGBT. So we're seeing not only rapidly growing numbers of older people in this country, but we're also seeing who those older people are change over time. And so a key question for all of us is, how do we build age-friendly communities? That's what the discussion is about today. And how do we ensure that as we build them, that those communities really are responsive to the different needs of diverse elders? Because the reality is that with diversity comes difference, and comes different needs and different challenges. And just to illustrate that point with a couple of very brief observations about LGBT older adults, what we know in our work at SAGE and what research shows, for example, is that LGBT older adults are 4 times less likely to be parents, right? So 4 times less likely to have adult children. They're twice as likely to be single and living alone. They're much more likely to be disconnected from their families of origin. And those differences matter because as people age, what those differences lead to frequently are high levels of social isolation and thin support networks. That then results in a need for greater support and services. But unfortunately, too often, what LGBT older adults, as many folks in this audience know, because you come from this community, too often services are not readily available as they should be. And we still, unfortunately, see discrimination in the federal safety net for older adults because of the federal government's refusal, as of now, to recognize same-sex relationships. So these are some of the differences we see. And we're crossing our fingers that problem is going to be resolved by the Supreme Court in June. We'll hope for that. So the question then, and the questions that we'll be discussing here, really are with that context in mind.